It is 8:13 now. It's Medicare annual enrollment period, but not for a lot longer. If you want to change your Medicare coverage for 2026, be sure to review your options and make a decision by this Sunday, December 7th. That's the deadline. Nick Karl joins us from People's Health with some tips. Morning, Nick. How are you?
I'm great, Tommy. Thanks for having me.
Thanks for taking the time. Let's jump right in. What are the main choices for Medicare coverage?
Yeah, so simply, there's two main options for people to choose. They can choose to go the original Medicare route, or they can choose a Medicare Advantage plan. And original Medicare, it's administered by the federal government, while Medicare Advantage plans are offered by private health insurance companies that have a contract with Medicare. And that's really the main ways you can receive your Medicare coverage.
What does original Medicare cover?
So it covers kind of most medically necessary services in your traditional, hospital settings, doctor offices, and other healthcare facilities, but it doesn't cover Part D prescription drugs or some of the routine services that people like, dental, vision, and hearing. So that's why many people enroll in Medicare Advantage plans, because these plans cover everything that original Medicare covers, but it also offers some of those extra benefits.
What kind of extra benefits?
So it really depends, because every plan is different, but most cover routine eyewear and hearing aids. They cover fitness centers at no cost to the member. And some even cover things, for over-the-counter items and wellness items. Some even cover healthy food items. So there's a lot of extra benefits that you can receive on a Medicare Advantage plan.
Do any of them include Part D coverage?
Yes. So most Medicare Advantage plans do cover Part D coverage as well. That's a good point. So you don't have to enroll in a standalone prescription drug plan when you're on a Medicare Advantage plan.
So let's talk about costs. Is Medicare Advantage more expensive than original Medicare?
Not necessarily. So again, like I mentioned, every plan has different costs and benefits, but your overall costs with a Medicare Advantage plan are often lower than what you would get on original Medicare. So because of this, original Medicare Advantage plans are required to limit your yearly out-of-pocket cost, while original Medicare has no ceiling. So, you could see some pretty high yearly expenses.
What else is different between original Medicare and Medicare Advantage?
So original Medicare allows you to visit any doctor or hospital that accepts Medicare anywhere in the U.S. And that's a big difference, where a Medicare Advantage plan often have network of providers and healthcare facilities that, usually require the member to use those. So that's one big difference. Medicare Advantage plans also may require referrals or, for you to see a specialist. Some require prior authorizations for some medical services and prescription drug coverage. And really a prior auth, that's a term that most people may not know. It means that you must get approval from your health plan before it pays the cost of a service. So in many cases, original Medicare does not have those, or a Medicare Advantage plan does.
We're talking with Nick Karl, who is helping us from People's Health to help you review your Medicare coverage, because you got to make a decision by December 7th. What advice would you have for making Medicare coverage decisions, Nick?
Yeah, to me, people need to understand that Medicare plans aren't really a one-size-fits-all. Everybody has different priorities and preferences. So you need to really think about what's most important to you. Maybe that's predictable cost. Maybe that's more robust drug coverage or lower cost to see a specialist. So now is really the time to do research. You need to read more. You need to figure out kind of understanding what may be offered to you under original Medicare versus a Medicare Advantage plan. And you need to think about what's best for you to meet your needs. And, your list of priorities can really help with this. And then talk to a Medicare expert, right? We've got licensed agents all over the state of Louisiana that sell all the different lines of Medicare Advantage and Medicare Supplement and Part D, and talk to somebody and have them help you. The Louisiana Department of Insurance has their Senior Health Information Program, or their SHIP program. You could call one of those counselors and they could help you as well. So you don't have to make this decision in a bubble. Use the resources that are out there to help you.
Seems like it can get kind of complicated, though. For people interested in Medicare Advantage, how would you go about choosing the plan that's right for you?
Yeah, so as your listeners know, there's many different Medicare Advantage plans that are available in Louisiana, and choosing one can be pretty intimidating, right? But it's not as hard as you think. So some of the ways is to check the cost, review whether a plan has a premium or deductibles, review and just make sure that plan fits your budget. You also probably want to take a look and consider what the coverage is. Make a list of the healthcare services that you most often use and make sure that those are covered and make sure that they're covered at a cost that meets your budget as well. And then if those extra benefits are important to you, make sure that those are covered, right? Make sure that you're covered for dental and vision and hearing and some of those extra benefits. A popular one is the fitness center membership. And as we talked about, make sure that Part D drug coverage meets your needs as well. Make sure that your drugs are covered and, again, are covered at a cost that meets your needs.
All right, we'll talk about some other things you can do when we come back. It is the Medicare annual enrollment period, but not for much longer. If you want to change your Medicare coverage for 2026, be sure to review your options and make a decision by this Sunday, December 7th. Nick Karl with People's Health is here with some tips. He'll tell us what else we can do when it comes to choosing a Medicare Advantage plan. When we come back, 8:20 Traffic Now, WWL. 8:25, Tommy Tucker, WWL, Medicare annual enrollment period. But if you want to change your Medicare coverage for 2026, be sure to review your options and make a decision by Sunday. This Sunday, December 7th, Nick Karl is here from People's Health with some tips. We've talked about some advice for making Medicare coverage decision, knowing that one size doesn't fit all. That Medicare plans, one size don't fit all. You got to do some research, talk to an expert. And for people interested in Medicare Advantage, when it comes to choosing a plan that's right for you, you got to check the costs. You got to consider the coverage. You're going to ask about extra benefits. What are some other things you can do, Nick?
Yeah, something else you could do is you could explore your plan's network, right? Make sure that the doctors that you're currently seeing or that you maybe want to see are in the network and will continue to be in the network for 2026. And if not, does that plan let you see out-of-network doctors, right? There are some plans that do allow out-of-network coverage where there are others that don't. So make sure you understand kind of what you're enrolling in. You can take a look and review the plan types that are out there. They can affect your costs, and the benefits available to you can differ. So, for example, some Medicare Advantage plans are specially designed for people who have chronic long-term health conditions like diabetes or heart disease. Other plans that are out there for people that are on Medicare and Medicaid that bring down your costs. So if you're eligible for some of those, special needs plans, as we call them, take a look and see if you can enroll in one of those plans. And last, I would say kind of talk to your family and friends and loved ones. While every plan is different and meets people's individual needs differently, word of mouth can kind of help you understand whether that plan supports and offers the services and customer service and whether that's high quality and meets your needs. So talk to your friends and neighbors and find out kind of what maybe they're receiving and what their experience is with that as well.
Some great tips. Any final advice, Nick?
Yeah, I would just say start doing your research if you haven't done it. We've been in this period, since October 15th, but it does end on Sunday. So take a look. Don't miss that deadline of December 7th. It's the only time really annually that most people can change how they receive their Medicare. So get that homework done. Take a look and make that decision by December 7th so your coverage can start on January 1st for the next year.
In a couple of minutes that we have left, talk about the People's Health plans, how people can find out more about it, and specifically about the People's Health Medicare Center in Metairie.
Yeah, so we have our Medicare Center in Metairie at 3017 Veterans Boulevard. It's between kind of Causeway and Trader Joe's, right there on that corner. We have licensed agents there that can help you with your needs. Appointments are recommended. You could call us and schedule an appointment, but we also allow people to walk in. And also our plan members that maybe, have questions about their benefits and how they're going to change in 2026. We have member service reps that are there that can help with that as well. So if you visit our website at peopleshealth.com, all of the resources and everything that we've talked about this morning are on there. You can take a look at our plan materials, our networks, all those things. Or you can give us a call at 1-800-978-9765. Again, 1-800-978-9765. And we have licensed agents on the phones that can help you and guide you and help you make a decision.
And I know with the center, it's better sometimes to go in and sit down and have it laid out in front of you, this, that, the other thing. Appointments are recommended, but you do have facilities or the staff to handle walk-ins, right?
That's correct. Yeah, we're happy to help people as they walk in and offer the services that they need.
Beautiful. Thank you, Nick. Appreciate it. It's a nice facility. The People's Health Medicare Center in Metairie, 3017 Vets between North Causeway and Trader Joe's. Appointments, as we say, are recommended, but walk-ins are welcome. You can also go to peopleshealth.com, or you can find out more by calling People's Health at 1-800-978-9765. We're going to take a break. We come back, we'll talk to Joe Giarrusso, New Orleans City Council member, going to be the CAO for a period with new Mayor-elect Helena Moreno's administration. And also, I'm still taking your text at 504-260-1870 on this National Cookie Day about what's your favorite cookie. And I got an interesting question about a cookie as to whether or not people actually eat it or just pass it around from person to person. Kind of like a fruitcake. I'll explain it when we return. Right now, time for WWL First News. For that, we go to Ian Ozan.